Thank you, and good morning. And I know I speak for the Lieutenant Governor and myself when I say how much we appreciate this opportunity to talk today about something maybe other than COVID. And I want to thank you, Ken, as well, for all the work that you do here. And I also want to thank the Plymouth County Mosquito Control District and Superintendent Ross Rossetti for your work. This is something that falls into the category of, if I made a list of the sort of top 10 things that I knew nothing about when I became governor, that I know far too much about now, this would be on the list. But that's in part because of how important it is. And you'll hear in a few minutes from Environmental Affairs Secretary Katie Theoharides and from Public Health Commissioner Monica Burrell, who I think will do a far better job of making the case with respect to why this is so important. But I can tell you this, that EEE is very real, it's very dangerous, and the work that's done by many of the control districts around the Commonwealth, including this one, makes an enormous difference in keeping people healthy and safe during the course of the summer. But before I get to that, I do need to say a word or two about COVID. Yesterday, over 7,700 COVID-19 tests were reported across the state. That brings our total number of tests to about 1.2 million that have been administered since the beginning of this. Yesterday, there were 157 new positive cases, which brings the total statewide number of positive cases to about 104,000. The 7-day average for the positive test rate remains at about 1.8%. That's a 94% decrease from the middle of April. There are currently just over 600 patients that are hospitalized for COVID-19 statewide, and as of yesterday, fewer than 100 people are in the ICU for COVID-19 across Massachusetts. The 3-day average on the number of patients is down about 83% since the middle of April. The number of folks in the ICU because of COVID is down about 90% since then. And only one hospital is currently reporting that they're still using surge capacity to serve patients. We saw similar numbers across the holiday weekend as well, and the public health data continues to show us positive trends on many of the key metrics. So far, Massachusetts has managed to reopen in many ways while continuing to do the things that everybody needs to do to contain the virus. And I think as yesterday, most people know, we officially entered phase 3 of our reopening process. I do want to give a special thanks to Lieutenant Governor Karen Polito for her leadership on this issue, balancing and wrestling through all of the issues that are associated with reopening in Massachusetts on a phased basis is an extraordinarily difficult task. And over the course of about a month and a half, I would say she probably, along with her reopening advisory board and with Economic Affairs Secretary Mike Keneally, probably met with something north of folks and organizations that represented well north of 1,000 employers and significantly more than 1 million employees here in Massachusetts. And I think it's a tribute to the discipline and to the commitment to the data that she and her team brought to this that we are where we are, just beginning phase 3 here in Massachusetts and still retaining some very low and importantly low statistics with respect to COVID generally. So thank you, Lieutenant Governor, for your work on this. It's now more important than ever, especially as we get into phase 3, that everybody continue to do the things that have made such a difference here in Massachusetts over the course of the past 120 days. That means continuing to wear masks if you can't socially distance, to socially distance whenever possible, to practice good hygiene, and to stay home if you feel sick, and to make sure that you take advantage of things like telehealth and many of the other things that have been put up either through our executive orders or by providers to make sure that you're in contact with your clinicians and your practitioners if you're concerned about your health status. We continue to make positive progress on the reopening, but obviously it's going to be critically important for us to understand that COVID does not take a summer vacation. And we all need to continue to do the things that have made such a big difference here in Massachusetts over the course of the past 3 or 4 months. Now, with respect to EEE preparedness, for the past few months, we've obviously been spending a lot of our time on COVID, but EEE remains an enormously important public health issue here in the Commonwealth of Mass. Eastern equine encephalitis is a rare but serious disease that spread to people through bites of an infected mosquito. Most years there are very few cases of EEE in Massachusetts, but every few years there are outbreaks with higher number of cases. We saw one of those just last summer. During the 2019 season, there were 12 human cases of EEE and 6 people died from those infections. And it's important to keep in mind that EEE outbreaks typically last 2 or 3 years. That means that we can expect the 2020 season to feature a high number of cases again. Our administration has been planning for the 2020 season and has taken a number of steps to protect people and communities from EEE. In a minute, Environmental Affairs Secretary Theodoridis will talk about our early spring preparations, including larviciding, spraying, and horse vaccinations. I'm especially looking forward to that part. And DPH Commissioner Monica Burrell will talk about surveillance testing that's currently underway and has already yielded specimens that are positive for EEE in certain parts of Massachusetts. She'll also discuss the DPH Public Awareness Campaign, which is encouraging everybody to take the kinds of steps, once again, that you can take individually to protect yourselves. In addition to these steps, the administration filed legislation earlier this year to enable a more effective statewide approach to combating EEE. Many cities and towns have access to critical surveillance and resources as part of their membership in a mosquito district control program. This is probably one of the reasons why we're here, is because Plymouth County has done such a fine job on that. In a minute, Acting Superintendent Ross Rossetti will talk about the steps that they are taking locally here in Plymouth County, and they're important ones that do make year over year an enormous difference in making the people in this community and this county safer. However, there are many cities and towns in Massachusetts that don't benefit from membership in a mosquito control district, and in these parts of Massachusetts, there is no entity, state, regional, or local, that can engage in what we would call the typical traditional mosquito control activities. And while a town-by-town approach might be okay for an average year of EEE, when you have a 2 or 3 year outbreak like what we're dealing with now, it really does require a different approach. Mosquitoes and viruses obviously don't pay much attention to city or town lines. The public health risks of mosquito-borne viruses such as EEE present and require a coordinated and unified approach on a statewide basis. The legislation that we filed with the legislature, which I do anticipate and hope will find its way through the legislature shortly and get to our desk, will allow the experts at the Department of Public Health and the State Reclamation and Mosquito Board to work together proactively to protect public health across the Commonwealth. When DPH determines that there is an elevated risk, the experts in mosquito control at the State Reclamation and Mosquito Board Control Board may take necessary actions to mitigate that risk. We've had productive conversations, as I said, with our colleagues in the legislature since we filed this bill in April, and we hope that we can work together to get this issue done soon. Passing the bill will be an important addition to existing efforts around spraying, surveillance, testing, and public awareness that are already underway in many parts of Massachusetts. The simplest way I can describe this is to say that most of the places that have mosquito control districts in Massachusetts are the places where historically we've seen EEE outbreaks. One of the reasons why we believe it's important to create a more statewide approach to this is because over the course of the past several years, and last year especially for the first time, we saw outbreaks in parts of Massachusetts we'd never seen before. And that was driven in large part by the changing migratory patterns of many of the birds that infect mosquitoes, who then infect people. And when we talk about a 2 or 3 year outbreak, the likelihood that the second year of the outbreak would take place in many of the places that the first year of the outbreak took place wasn't a sure thing, but it was certainly something that I think many of us expected and anticipated. And not surprisingly, the first case of EEE that was picked up by the DPH surveillance lab was actually in Orange, Massachusetts, which is, again, sort of a new location with respect to where EEE is located, and there is not a mosquito control district there. So part of this is about dealing with the fact that as the virus, not COVID, as the EEE virus migrates a bit, as birds and mosquitoes migrate, it's important that we think a little more about this as a statewide issue and not so much on the particular areas where we've always focused on it, where historically have been the places where we've typically seen the biggest outbreaks associated with EEE.